Hi everybody, I'm so excited that you guys are starting the first chapter of Health 2.0 in Mumbai. Congratulations to Dinesh and to all of you. We here at Health 2.0 can't believe we now have 42 chapters all around the world. Mumbai is going to be the second chapter in India, but I hear it's the hub of all sorts of commerce. I myself am from Bangalore, but no competition there. Just kidding. We just want to send our best wishes and encouragement and support. It sounds like you guys are going to have a great event and a great community here.
Health 2.0 is a global community and a platform which integrates pharma and healthcare industry with emerging medias as well as technology. So the objective of Health 2.0 is basically to accelerate patient-centric as well as doctor-centric solutions, in turn integrating the media. So Mr. Dinesh Chindarkar, the Vice President at Media Many Communications, who also spoke at the India conference, the national conference that was held, felt the need to come up with a local chapter in the commercial capital also, Mumbai. And thus 3 months ago, Health 2.0 Mumbai chapter was formed.
It's all about, I put up a chapter. Yes. Post that, I was really passionate about Health 2.0. I liked the concept. I liked the whole philosophy that is going beyond this, and I feel that India needs it. So when I spoke there, I realized that people from diverse backgrounds can come together and actually drive this course into a different direction, into a very constructive direction. And these both parts, the India and the Bharat, needs this, and we are moving towards that. It is about health insights. It's about doctor usage. It's about empowering patients. It's about young startups, and it's all about patient 2.0. I think we have people across this sector here in India. So we'll have varied people talking about their experiences about Health 2.0, so that as a group, we work towards converging towards Health 2.0 and finding solutions so that it can touch human lives.
There are certain websites now, Adit must be knowing all that one of the doctors, he's a radiologist. What is a PET scan, what is a CT scan, all that information, what basic information a patient wants, he has put that on the website. Similarly, it was for the Beams clinic, how the Guinness Book of World Record, the name was there, Limca book. So this type of information when you put on the website, a lot of trust will also, whatever it has been your area of work, if you put on the website, a patient develops more of trust on that. Some websites like Mayo Clinic, Merck books, they are authentic websites. A patient will not just go and whatever the patient does not know which website is authentic, which is not authentic. So if the doctors say, if you really want to check, go to these websites. Another area is patient is very curious about the side effects of the drugs. You can have that on a social media and all is fine, but as I said, initially stethoscope was there, X-ray was there, but they used to come one in 10 years or 15 years and they are exposed to this. But now technology is not a part of medical education. So whatever we have to talk in their language, then only they will be able to understand how they can use best for the patient.
Our objective is not to misinform the patient, but because of his increasing awareness, increasing education level, increasing resource to internet and everything, they are reading it, but not understanding it. So we need to customize content according to the recipient. That is the key message. It needs to be credible. It needs to be creative. Because creativity is what will attract the individual. And it needs to be correct. And most importantly, it needs to be concise.
So there might be some questions, but if you ask that, if I keep on asking, you will discover that there's opportunity there. There's not a single website in India which a patient says, this is the website which I go to. What they do is they go to Google and they put the keyword, and on an average there are 22 million health keyword which gets searched every month.
What doctors right now are more interested in is how to use technology in their day-to-day life, in their day-to-day practice to improve their patient referral, their patient connection relationship, grow, reduce cost, improve efficiency. But today there has also been a shift, maybe work with Dr. Shalini is doing, where they see the patient as an important factor in the software. So they are looking at a lot of patient engagement being part of the software. Not only that, but they are also looking at medical records being a kind of ethical value add to what they need, because they need to have that record kept properly, it should be shared, it should be stored. They can access that information better when they are making decisions.
Everything is gone. Obviously the hospital apologizes, and the doctor, the diabetologist at the hospital, he doesn't have any clue. Because, what will I do? I don't know. I see about 100 patients a day. How will I remember what I was, But it was a difficult situation. So that's when, it actually came to our mind that, ideally what we should do is that give power to the patient, from the doctor to the patient. That is, obviously there is no cure for diabetes, which means that you only have to manage your disease. It's just a lifestyle management disease. This is a prototype which we have come up with. I was about to show you a video, but so this is a prototype. It's been about 8 months. It's taken to develop this prototype. So what it does is that it's a hardware device which fits into your glucometer data port, and it wirelessly transfers your readings from the glucometer into your smartphone. Straight away, the graph will be emailed to your diabetologist, and then she can give you all your whatever advice. So this is how it goes into your glucometer. This is a one-touch Ultra 2 glucometer. Let me just show it to you. And this is the graph it plots. This is how it plots. Yeah, sure. You can just feel the button, so that the visually impaired people know that this is the button which they have to press it. And when it buzzes on, obviously they would know that the device is on. So, and also the design, we have made it in such a way that people with motor disabilities, that is, people with motor disabilities of their hands, can easily switch it on, can easily hold it, and at the same time, people with type 1 diabetes, that is a juvenile diabetics, they would also hold it in their palm. And obviously they find this design very cute, even before we have launched it. And this is all power of Health 2.0.
This is a really good initiative. We have started, I guess, very vibrant community. There are really some good talents around.
It was a wonderful interaction. Though small, it was very, very nice to have a good cross-section of people here and interacting on this common platform.
Actually, it's the first of such sessions where pharma companies and the IT healthcare background people are coming and sharing their views and opinions.
If India has to really move ahead in this direction, I think this kind of interaction is a must.
These kind of events which actually brings all the medical people from medical fraternity, from people from the technology background, people from startups all together, and we really need these kind of platforms much more in Mumbai.
I think there should be more such platforms where people from all areas of healthcare like pharma, educational background, medical professionals, IT professionals, they are together and discussing about how technology can intervene and create a change in the healthcare scenario.